Hello and welcome to The Family Pet on News 12 Long Island. I'm your host, Dr. Jonathan Greenfield. Later in this show, how to keep your pets free from ticks and fleas this summer season. But first, it's a topic no one likes to talk about, but more and more pet owners are having to deal with it. I'm talking about pets being diagnosed with cancer. And here to talk about this disease is Dr. Diane Levitan and Dr. Gerald Post from the Center for Specialized Veterinary Care. Thank you both for coming. Certainly do appreciate it. It's a topic it's a rough topic, but I think it's something that we really need to talk about. Jerry, maybe we should kind of set the tone by having you explain to us what is cancer.
Cancer at a very basic level is unregulated cell growth. Basically, cells that are growing beyond the body's ability to control their growth. And when it comes right down to it, cancer is really a genetic aberration.
What type of cancers do we normally see, or if I can use the word normal, do we see in our pets?
Sure. So the typical types of cancers that we see in our practice are lymphoma, mast cell tumor, osteosarcoma or bone cancer, hemangiosarcoma or a cancer of blood vessels, fibrosarcoma, transitional cell carcinoma, some leukemias.
Are these tumors or cancers any different than what we see in people?
Very, very similar. Actually, if you look at the types of cancers that children get, it's very similar to the types of cancers that dogs and cats get.
Speaking of dogs and cats, why don't we introduce our guests who are actually dealing with cancer and have done very well. We have Jack here on the side. Why don't you tell us a little bit about him? So
Jack is a 7-year-old lab who was diagnosed with lymphoma about 1.5 years ago. He went through 1 year and 2 months worth of chemotherapy, and he is now cancer-free and has been off chemotherapy since March.
Wonderful. And our little kitty?
This is Chrissy. Chrissy was also diagnosed with lymphoma. She is about 1 year into her therapy, doing wonderfully. She is in remission and has about another 6 months to 1 year worth of chemotherapy left, and is doing wonderfully. And last but not least is Lucy. Lucy was diagnosed with a very aggressive type of mast cell tumor in her inguinal region that had already metastasized or spread to her lymph node, and she was treated with surgery and then follow-up therapy with radiation therapy, and as of now she is also cancer-free and doing great.
Diane, how do we detect cancer in our patients? Can we see it? Can we feel it?
That's a great question. Yeah, lots of times we can see it and we can feel it, and because we spend so much time petting our pets and getting personal with them, we can find them by touching them, because some cancers you can feel, but not all of them. So regular visits to your veterinarian are very important, just for a checkup to make sure that they don't find anything on a very good physical exam. And then we have lots of different diagnostic methods if our animals aren't doing well, where we can find what's going on. Ultrasounds, x-rays, more advanced testing like CAT scans and MRIs can all be used to help us figure out exactly what's going on, and then we would have to do a biopsy of some sort to help us determine exactly what type of cancer we were finding.
What about blood tests? You know, in some diseases in people, we have specific blood tests that give us a hint, I mean, not necessarily diagnosed, but a hint that there's something going on. PSA in men for the prostate. Are there tests in animals that can do this?
You know, it's funny, as we know, most people always ask us, why can't you tell from a blood test? How come you can't tell? And soon, hopefully, in the near future, we will be able to do a lot more from blood testing, but there are very few blood tests that actually can pinpoint a type of cancer at this time.
But the blood tests can give us an indication that maybe something's wrong with a particular organ?
Right. So the abnormal blood tests tend to lead us to additional testing. For instance, leading us to do x-rays or look at the urinary bladder with an ultrasound, or look at different organs with ultrasound, or perhaps CAT scan or MRI, as we discussed earlier.
Jerry, is that something that you do as a practitioner quite often, the MRIs and the CAT scans? I mean, we hear about people all the time, but do we do it in our pets as well?
Absolutely. CAT scans we do quite frequently. We also do MRIs more for things like brain tumors or chest wall masses. But absolutely, those advanced diagnostic tests are becoming more and more common as people are becoming more and more invested into their pets. They're thinking them more as family members and really pursuing the same diagnostics that are available to people.
When you talk, Diane, about diagnostics, of course, the laparotomy, if it's an abdominal problem, I guess is one of the major ways of getting in and actually getting your pieces of tissues.
Right, so you're talking about You're talking about opening it surgically and taking a piece of tissue, because of course you can't tell exactly what type of tumor, or even if you have a tumor, sometimes things may appear to be a tumor but may not be. So biopsy is by far the only way you can really tell exactly what you're dealing with.
We used to have to make big incisions and open the animal up completely. Now we can do it almost laparoscopically.
Right, now we have actually a newer technology, actually just arrived at our clinic today, a single port technology where you just make a little tiny hole, just one hole. We can look in the entire abdomen and take biopsies that way. So very quick recovery time, very simple way to take a biopsy sample.
We're going to have to take a break. Up next, the different treatments for pet cancer. You're watching The Family Pet on News 12 Long Island. Back to The Family Pet on News 12 Long Island. We're talking about treating your pet for cancer. Once again, joining me is Dr. Diane Levitan and Dr. Jerry Post from the Center for Specialized Veterinary Care. I guess, you know, the general practitioner has made the diagnosis, calls you guys up and say, my patient has cancer, what do I do about it? Sure. These guys obviously are survivors, so Absolutely. Maybe we can use them as examples as to what kind of modalities you're talking about treatment-wise.
Absolutely. So with Jack, he was diagnosed with multicentric lymphoma, and after the diagnosis was made, we what's called stage him, which is basically to find out where the cancer is and where the cancer is not, with x-rays, ultrasound, bone marrow tests, and to find out what type of lymphoma he has with what's called immunophenotyping. After that, we used chemotherapy on Jack to treat his multicentric lymphoma, and we put it into a nice remission, and he's obviously continuing to do well and still in a remission.
Now, Lucy, you did a little differently, didn't you?
Lucy, we did differently. Lucy was diagnosed with mast cell tumor. We also then staged her, found out that her cancer was unfortunately in a lymph node. Some surgeons removed the cancer as well as her lymph node, and then we finished treating her with radiation therapy at the center. Mm-hmm. And also, she's done very well. And Chrissy was diagnosed with lymphoma with a biopsy, as Diane was talking about before, and after that we also treated her with chemotherapy. So the three modalities that we've talked about are surgery, radiation therapy, and chemotherapy, and then the other modality that we use at the center is immunotherapy.
Are we seeing more successes than we ever saw before?
I think as people allow us to treat their pets, yes, we definitely see more successes because we have Jack, you have a lot to say. We are constantly finding new and better methodologies. Mm-hmm. And so with people like Dr. Post, who are really on the cutting edge and doing everything possible and really knowing the very latest and the greatest ways to treat these pets, they really do very well. But you're right, they don't all survive, and many of them will die from their disease, but many will go on to pass away from other things. Is
it also possible, too, that we're catching the disease earlier, that the general practitioner is finding the disease earlier, so when he sends them to you guys, it's easier to treat?
Yeah, I think that's a really good point. I think that with regular well visits and good physical exams, the general practitioners are absolutely finding them, and also finding it very easy then to refer to a specialist when they do encounter something like a cancer.
Absolutely. Just like in human medicine, the better a patient feels prior to undergoing chemotherapy, the better that they do. So as the family veterinarian is finding these cancers in animals that are healthier, that allows us to treat them with chemotherapy or radiation and get better results.
When we talk about chemotherapy, surgery, radiation, it all sounds very expensive.
It's true with newer technologies and these greater advances, the equipment that we purchase is the same equipment that they have in human hospitals. So yes, it is very expensive, and so the cost of maintaining them and using them is expensive. But it's not cost prohibitive, and we certainly want everyone to be able to take advantage of it. So we try to make it as affordable and practical for everybody to be able to take advantage of it. That's why we have it.
We hear the word remission versus cure.
Sure.
What's the difference?
Well, remission basically means that we're not able to detect cancer, whether it be by feel, whether it be by x-ray, ultrasound, biopsy, and nowadays even there are genetic tests. There's what's called PCR, a polymerase chain reaction test, that we can use to detect cancer. Cure is really a diagnosis or a phrase that we use retrospectively. In other words, after an animal has survived for 2, 5, 10 years after a cancer diagnosis, then we can safely say that that animal has been cured. One thing I would like to say as far as cost is what we try and do at the center is we really try and offer the best therapy available given an owner's, fiscal constraints and an ability, to afford therapy. There are many different protocols from many different types of cancers, and we really try and make sure that, we offer therapies that they can afford.
Is there one type of cancer, Diane, that you see more than others that you could say, I do a better job with this because it's easier to treat?
I do a better job because I say, Dr. Post, I have a cancer patient. Can you help me? So honestly, it's more, I have the luxury of deferring to a specialist right in my same building. So that's what I often do. And so you can take that one, Dr.
Sure. I think that certainly with lymphoma and mast cell tumor, the two animals that, the three animals that are here with us today, I think are really good examples of types of cancers that we're becoming more and more successful at treating. Survival rates have more than doubled in the last probably 5 years to 10 years in the treatment of both of these types of cancers.
Well, thank you both for coming and telling us about this today, because it's something that we need to learn more about, unfortunately. If you'd like to learn more about the Center for Specialized Veterinary Care, you can log on to our website at www.news12.com. Up next, providing comfort for your pet during the tick and flea season. You're watching The Family Pet on News 12 Long Island.